PreviewDental.tv.
Joining me now is Dr. Alan Pomeranz, a professional periodontics and implant dentistry in Denver, Colorado. Dr. Pomeranz, so glad you could join me today.
Thank you, Jackie.
Tell us a little bit about your training and your background.
Absolutely. My training, I've been in practice in Denver now for about 9 years. I originally grew up in Denver. I'm a second-generation native, and after I decided to go into dentistry, I went to Boston and spent about 7 years doing my training, 4 of which included Boston University for my dental training, at which time I really felt I got an excellent clinical education and had great mentorship. When I was done with my dental school, I moved to Harvard University to do my periodontal training, at which time I got excellent clinical training with some of the top clinicians in the country. Once I was done with my periodontal residency, I moved back to Denver with my wife, who's also a Denver native, and when we got to Denver, we started a family of our own. At this point, 9 years into practice, I have 3 wonderful daughters who keep me very busy and very young.
Probably nice to be back in Colorado, though.
It's a great place to raise a family and be from, and I have a large family.
Well, let's talk about dentistry. What
Absolutely.
might a typical periodontal patient look like?
Sure. The periodontal patient can run the gamut. We have patients who come in with an individual problem, maybe one particular tooth where they're missing some gum, or maybe they had a traumatic accident where they lost a tooth, they need it replaced. If that's the case, and we can take care of those in a few simple procedures. On the other hand, we have somebody who has a full case, somebody who has a full mouth of periodontal disease who may not even know that they have that disease. When somebody comes in, we like to undergo a full clinical evaluation to really measure a lot of different areas around the teeth to see what's really going on and evaluate with some x-rays and give them a proper diagnosis. Once we have that diagnosis in hand, we can give the patient a treatment plan that's best suited for their needs and their budget.
Dr. Pomeranz, tell us a little bit about a patient you just recently had.
Well, one particular patient that comes to mind is a woman who I had seen about a year ago. She came in and had pretty significant periodontal disease. And at that time, she also had gone through orthodontics and unfortunately was going to lose all her teeth between the 2 problems. What we did was to remove all her teeth and replace her teeth with implants in various positions and then fabricate bridges to attach to those implants. When the treatment was done, we had recreated her entire smile in a full fixed case of teeth based on implants, really improving her overall quality of life.
What did she think after it was all done?
She was very happy. It took a long time, but she was really happy, and she walked out with a huge smile.
Yeah, I'm sure the end result's priceless, huh?
Absolutely.
If someone watching is interested in finding out if they're a candidate for a periodontal procedure, can they go online?
Absolutely. Our website is yourdentalimplants.com.
Very good. Dr. Alan Pomeranz, thank you so much for joining me today.
Thank you.
Find more dentistry-related videos at PreviewDental.tv.